What is the biggest misconception patients have when they are first diagnosed with HIV?
The biggest misconception I feel is that people consider in an HIV diagnosis to be a death sentence. So with these patients, you have to deal with them very compassionately, and many of the patients, even till date, they think that HIV is associated with social alienation and a limited lifespan. But in reality, with an early diagnosis and proper ART administration, these people have an increased life expectancy, and they can expect a near normal life expectancy for that matter. And proper detection is very important in such patients. Another misconception is that people think that they might inevitably they might transmit this infection to their loved ones, which is also not true if they're on regular ART medication. So targeting these questions early on is very essential with these patients, so that they don't shy away from taking those treatment options that we are providing to them.
How has ART changed the life expectancy of people living with HIV today?
ART has transformed the life expectancy a lot. Like before, we had ART, HIV would progress to AIDS, and then eventually it would lead to premature deaths. But now, with the advancement in medical sciences and with regular ART administration and people adhering to their medications, people can expect a near normal life expectancy with that. And there are many patients who have gone forward and started work, and they're raising families, and they're doing much better mentally and emotionally also in their lives. So dealing with compassion, again I will point this out, dealing with compassion and informing our patient regarding what they're getting into when they're having these medications is very essential, and it absolutely changes the trajectory of a patient's life if you're informing them properly about it.
What does undetectable equals to untransmittable means in real life patient care?
Okay, so undetectable is equals to untransmittable means that a patient who has HIV and their viral load is undetectable because they are on regular ART. So by the normal methods the modes by which they can transmit this infection, if they are undetectable, they won't be able to transmit this infection. So undetectable is equals to untransmittable. And that is only achieved when we regularly get these patients to be strictly adhering to these medications. Adherence is very important. So convincing them and getting them to know on a personal level is very important. So basically, if these patients are taking regular ART, it is a very good example in our society that undetectable, that means if we're giving these medications to these patients, medication is actually the root thing which causes prevention. So causing these patients and getting these patients to the ART center and having them adhere to those medications is really important. So that is what undetectable equals to untransmittable means.
Okay, can an HIV positive mother deliver an HIV negative baby with proper care?
Absolutely, she can, provided that she is on regular ART medications and she has proper antenatal checkups and she strictly adheres to the medication. We have had so many cases at our ART center, rather 100% of our pregnant women who have been detected with HIV, they have given birth to children who are not HIV positive, and that is only because we have strictly monitored their viral loads and we have kept them suppressed. Their viral load has been suppressed, and also they have been strictly monitored to take their HIV medications, because of which they have HIV free children now.
So what is ART and what are the main goals, and are the medicines provided under ART free of cost?
Of course. ART stands for antiretroviral therapy. Okay, so the main goals of this and what it is that it's basically a combination of antiretroviral drugs which causes suppression of replication of HIV in the patient's body. So the main goals is that at a community level and at an individual level as well, it causes, like for example I told you, undetectable is equals to untransmittable. So even at an individual and community level, we are preventing HIV. It is used for achieving and maintaining viral suppression in these patients, and also to reduce the HIV related complications and opportunistic infections that a patient can get. And of course, the mental harassment that people might go through in our society in today's world, that is related to it, and even the social stigma to make it less in our society, which is there a lot. When you interact with these patients, you get to know what they're suffering. So basically, these are the main goals of ART. And under our NACP, that is the National AIDS Control Program, these medications are given free of cost under government-run ART centers. So it ensures that an equitable distribution of these medications are given to people regardless of their socioeconomic background.
Would you like to share any personal experience that stands out to you with any patient or their family?
Recently, there has been one case that I can't get out of my mind. There's this one young patient who had come to us who got diagnosed with HIV incidentally, and this patient is very young. And initially, when this patient came to us, they were very withdrawn and they were very anxious, and they felt like their life was over and they did not need to have any life goals after that. But with proper counseling, with proper diagnosis and ART initiation, we have managed to get the viral load of this patient to undetectable within a matter of months. And now they're living a normal life, they're emotionally motivated, and they're looking forward to the next opportunities that they get in life. So that's, as a practitioner, it feels very nice to see, your patients going from here to here.
Thank you.